in addition to the study that Susan shared, there is also another recently published study by JAMA Network Open around the prevalence of depression symptoms in US adults. And in that study, you saw that depression symptom rates for US adults are 3 times higher than before the COVID-19 pandemic. And because of such, Kaiser Permanente is really encouraging our employees to seek our various resources, the main being our employee assistance program. So we've had our EAP program actually in place for over 40 years. It's in-house, so we have our in-house consultants, but we also have a EAP vendor that serves some of our smaller markets outside of California, where we're largely situated. And so this program is really leveraged in every situation, whether it was dealing with a pandemic, all the social unrest, to all the disasters we were experiencing. We were impacted pretty heavily by the California fires. We had employees who actually lost their homes. You name it, any situation, EAP was always plugged in there as a resource to go to. And that service provides our employees with a licensed counselor to gain additional support in a one-on-one setting. But on top of that, our EAP program is also available to host group sessions, provide organizational support and guidance, manager consultation. So they really serve a number of resources. And they have been the program that we've been able to shift and adjust based on the needs that our workforce is experiencing at the time. So for example, one of the more recent topics were around how do we balance work, for the groups that are moving to this remote environment with balancing that and care at home, whether it's a child or a family member, and a significant amount of fatigue and burnout kind of related to that topic. So our EAP program hosted a live teletown hall that focused specifically on that topic because we saw that being raised as a real concern and had thousands of people come attend that session. So again, it was an example of how we've kind of adapted to listening to those needs. And Kaiser as an organization, I mean, we stood up immediately once COVID hit. A Here For You call center and website where you can go to provides 24/7 support for all things aside from kind of the mental health support, relief, benefit reliefs, childcare resources, hotel accommodations. And we're constantly kind of updating that as, we kind of move through these COVID phases. So, really during the pandemic, we have been able to really expand a lot of our services. And as an organization, because we're an integrated healthcare system, we also provide mental health to KP members, just not to our employees. And in that space, before COVID, we had less than 20% taking advantage of telehealth, utilizing the virtual option to have mental health visits. It was less than 20% before COVID. And just this year, we're up to 99% of our mental health visits being done virtually. So significant increase in use of virtual care, which we're so pleased. I mean, it really accelerated, our this was our goal, long ago. And, the COVID experience really accelerated us to getting to a virtual telehealth setting. That's and then awesome. On top of, I think it just goes to show you that we have been an agile organization, and we really have tried to leverage not only the great resources we provided our KP members, but also some unique things to our workforce. Probably the last two things I think are worthy of actually noting is that in addition to the telehealth and a number of online resources that KP members can go to, we actually offer now for our KP members 2 self-care apps, so My Strength and Calm, which are at no cost to our employees, or no cost to KP members, in fact. And so for those employees who are KP members, they have full access to both apps. And we know that for our membership, more than 250,000 members registered for the app in just the first 2 months of those being released, and they continue to climb every day. So just a few examples of some of the things we've been doing to really adjust to providing resources for our workforce.